Good day, Kaalaga! My name is Leia, your future nurse. For today, I will show you the neurological assessment, but first, I will just shortly discuss this area for more understanding. Neurological assessment, it is an evaluation of the nervous system of a person, including the brain, spinal cord, and the nerves that connects this part to the other parts of the body. Equipments needed in conducting this assessment is the examination gloves, Snellen chart, pen light, stethoscope, ophthalmoscope, magazine, hot and cold water in a test tube, substances that would use for smelling and tasting, sterile syringe, tuning fork, and objects that fits to the person's hand. Now, let's do the procedure. Prior to the assessment, first we need to identify the patient to give the right care and management to them. Introduce yourself to the patient, explain clearly the procedure because it allows them to understand and encourages compliances throughout the assessment. Provide privacy by drawing the curtains and closing the door to allay fear and anxiety. Please do not forget to properly wash your hands for infection control and use gloves to protect the patient and at the same time protect yourself. Then, ask the patient to void first to have a continuous procedure and to be not distracted while performing the assessment, and obtain the patient's health history. Good morning, sir. How are you?
Well, I'm good, thank you.
May I know your name and your birthday?
I'm Kevin Dale Valdez, and my birthday is March 22nd, 1989.
Okay, sir. My name is Leia, your nurse for today. I would like to ask your permission because I'm going to do a neurological assessment. I will be the one who will assess your motor and sensory skills, hearing and speech, vision, coordination, and balance. I may also test your mental status, mood, and behavior. But before that, I will just ask some couple of questions regarding to the assessment. Is that okay with you, sir?
Yes, it's fine.
Have you ever been diagnosed with neurologic illness?
No,
Have you experienced high blood pressure or headache?
sometimes a headache.
How's your vision?
It's fine. Last checkup I have 20/20 its vision. Both eyes?
How about the sense of your smell and taste?
It's also fine. I don't have experience losing me sense of smell and taste.
Do you experience drooping of some areas of your body?
No,
Do you experience changes in your hearing and balance?
no,
How about your sensation and motor activities?
it's okay. I don't experience turbulence when it comes to my activities.
Sir, can you please describe your daily diet?
I always eat rice with viand mixed with soup, vegetables and fish, then have a fruits and drink water every day.
Are you taking any medications?
None.
Are you exposed to strong insecticides, organic solvents, or lead toxic wastes?
Nope.
Okay, for that, let's begin with assessment. Instruct the client that changing positions might be done during this procedure and assure that you can stop anytime if he or she feels discomfort. Explain that you will conduct a variety of tests, observe the client, and note the client's speech and language abilities. Sir, in this assessment, I might ask you to do some things like changing your position or do an action that accords to the procedure. I will inform you the things I will do and I can stop anytime if you feel uncomfortable. Is that okay with you, sir?
Okay, understood.
Sir, can you please sit upright?
Yes, it's okay.
Sir, as I observe, you have a good personal hygiene, you are proper in grooming, you are showing facial expressions, and I understand your speech. There's also variations in the tones of your voice, and you speak smoothly and clearly. Remind you that when a patient does not have a good personal hygiene, it may indicate of mental issues such as depression or schizophrenia, or the client may be experiencing organic brain syndrome or obsessive compulsive disorder. The rate of the speech is, are they talking too fast or slow? The tone of their voice, the loudness and the softness of their voice. All of this must be noticed. Apart from that, most mental clients have monotonous speech, and these changes in speech could reflect anxiety or whether the client has Parkinson's disease, depression, or various formats of aphasia. Let's proceed to the next assessment. Assess the client's sensorium, memory, ability to calculate problems, and assess the client's ability to think abstractly. Sir, can I ask what is the date right now, and the time you came here, and the reason why you are here?
It is July 23, 2021. Then I arrived 10:30 am and I went to have a health checkup in my neuro.
You are full of alertness. Now I will ask, when is your birthday, where do you live, and your educational background, if it's okay with you.
I was born March 22, 1989. I lived at Sesame Street, Quezon. I am now currently third year college with the course of B.S.A.
You have a sharp memory. Now, sir, I will ask you to calculate the problems. Okay, sir. 3 divide 9.
3.
11 times 11 minus 11.
110.
100 minus 8 plus 10.
102.
Okay, you are good in calculating problems. Now, sir, tell me the similarities and differences between an apple and an orange.
An apple is red or green color. Its shape is forming a heart. It's hard. While an orange is forming a circle shape, then it's juicy and soft inside. Their similarities are both of them are fruit and good in health.
We cannot expect the patient to be alert 100% if they are lethargic or in a coma, because any cortical or brainstem diseases contributes a change in consciousness of level, and a stroke or hypoglycemia could also induce the level of consciousness of the patient. When we assess the client's memory, if they are confabulating, the abnormal findings is they might be experiencing a long-term memory loss or Alzheimer's disease. Remember, inability to calculate simple problems may indicate presence of organic brain disease or simply lack of exposure to mathematical concepts, or maybe an incomplete understanding of the examiner's language. The abnormalities in the client's abstract thinking are sometimes cause of lack of education or could lead to mental retardation or dementia. Clients with personality disorder, for example, with schizoid or schizophrenia, have an answers beyond the words. Now, assess the client's mood and emotional state, then assess perception and thought process. Then the client's ability to make judgments. Sir, you show facial expressions congruently to the tone of your voice. Now, what can you say about the quote by George Bernard Shaw that life isn't about finding yourself, life is about creating yourself?
It is an inspirational quote for me, where people are lost in finding their own identity, but in reality, you are the only one who can decide who you are. People are not lost, they are creating their becoming in this life.
You have the ability to complete your thought, you are confident, and your answers are relevant. You are aware of your reality. Now, sir, if it's okay, can you tell me your future plans after you complete this course?
I hope to pass the board exam, then eventually apply in some company. Help my family, then save money for future savings when I am ready to build my own family.
Take note, if the client's mood changes while being questioned, ask them if possible to identify the event or incidents that causes their mood or emotional state to change. Because lack of congruence in their facial expression and the tone of their voice with the content in the context, it might be because of neurological problem. Neurological problems like anxiety, fear, anger, overconfidence, or ambivalence. And associated bipolar disorder, anxiety disorder, or major depression can also occur for clients with emotional disturbances or having a psychogenic disorders. Remember, disturbed thought processes can indicate neurological dysfunction or mental disorder like disturbances in sense of reality. It includes hallucination or illusions in assessing the perception and thought processes of the client. While in assessing the client's ability to make judgments, their response would reflect to their psychological ability and stability. It would also reflect their family situation and obligation of the person to the family and to the society. Let's move forward for the test of cranial nerves. Instruct the client on what are you going to do and inform that you are going to test for several special nerves. Test the olfactory nerve and then optic nerve. First, close both of your eyes, then close one of your nostrils, then sniff the object I am holding. Then tell me what it smells. And after that, to the other nostril with the same procedure.
A lotion. Cologne. Alcohol.
Okay, sir. You are correct. Now, to the other nostril.
Perfume powder. Smells like ginger. A peanut butter.
Okay, good. You smell them correctly. Now, to your optic nerve, sir. Can you please read this magazine in near distance?
Take the lead in the corporate industry with the business and management programs. Gain the competitive edge by learning principles and practices in the fields of marketing.
Now, sir, you will read the Snellen chart. Read the letter I will choose in a 20 feet distance. Cover your left eye. Then read the letter I will point. Then after that, cover your right eye, then same procedure. Okay, now, sir, please read this letter.
G, E, C, F, U, X,
Here,
O, Q, R, Z, M,
this letter,
K, W, V, S, Y.
T. Okay, sir, you can read in near vision. Then you can read also in far vision. You have a 20/20 normal vision on both of your eyes. Bear in mind that anosmia is the absence of the sense of smell. This might happen due to the cranial nerve dysfunction to the olfactory nerve or secondary to colds, zinc deficiency, or it could be genetic. And unilateral changes in the sense of smell could lead to brain tumor if the nostril is good and the other one is not. The pathologic conditions of optic nerve could include retrobulbar neuritis, papilla edema, or atrophy. Next procedure is assess the oculomotor, trochlear, and abducens. Then test the trigeminal nerve. Now, sir, I will check your oculomotor, trochlear, and abducens. I will just check your 6 cardinal gaze. Now, look at this pen light, then follow its direction. a wheel method. We will test your pupillary reaction to light. Sir, you are able to follow the direction of the pen light. Your pupils are equally rounded, reactive to light, and accommodation. I will touch your arm with the use of the wisp of the cotton ball. Tell the word now if you feel them, and tell the word stop if you did not feel them. Okay, sir? Please close both of your eyes.
Now.
Okay, sir. Now, open your eyes. The next procedure is, I will touch your arm with the use of this paper clip. This rounded end, you must feel dull. Then, this point end, you should feel sharpness. Tell now and dull or sharp if you feel them. Okay? Then tell the word stop if you did not feel them. Okay, close your eyes again, sir.
Now it's sharp. Now it's sharp again. Now it's dull.
Okay, now open your eyes, sir. The next is to your face. I will use again the wisp of the cotton ball. Then tell the word now if you feel it, then stop if not. Then after that, I will use the paper clip. You will also tell if it's dull or sharp, and then the word now, and then tell the word stop if you did not feel them. Okay, now close again both of your eyes.
Now it's dull. Now it's sharp.
There's no presence of abnormalities upon the test. For the motor function of your trigeminal nerve, can you please clench tightly your teeth, just like this? Now, okay? Okay. Now, I will palpate bilaterally your masseter. Okay, for your temporal muscle, can you please open and close your mouth? Open, close, open, close. The movement of your mandible is symmetry without division from the midline. The abnormal findings in the oculomotor, trochlear, and abducens includes nystagmus. It is the voluntary movement of the eyeball. Then, strabismus, it is the lack of muscular coordination of the eye. Then, diplopia, it is a double vision. While in the trigeminal nerve, abnormal findings is any loss of sensation, manifest fasciculation, muscle pain, muscle spasm, and the division of the mandible indicates myofascial pain syndrome. Proceed to test the facial nerve, vestibulocochlear nerve, the glossopharyngeal, and the vagus nerve. Okay, sir, I'm going to check your facial nerve. Can you please smile? Good. Now show me your teeth. Close both of your eyes. Open it now. Then, I want you to puff your cheek one at a time, just like this. Okay, good. Now frown. Raise your eyebrows. Okay. All of them are symmetrical in movement. I need you to close your eyes. Keep them closed. I will touch them simultaneously, then bilaterally. Okay, good. Now, I need you to puff your cheeks one at a time, then I will apply pressure. Good. Now on the other side. Okay. Now I have 3 applicators. I need you to taste them and tell me what it tastes. I will provide water for cleansing the taste and for better identification. Say ah.
It's salty.
Okay, water. Then here.
It's sour.
Next one.
It's sweet.
Okay, good. Alright, you are correct. Now, we will test your vestibulocochlear nerve. For your auditory branch, we will perform the Weber test and the Rhine test. For Weber test, I will place the tuning fork to your head and tell me if you hear it synchronously or not. While for the Rhine test, I will place the tuning fork to your mastoid process. Tell me if it stopped, then I will do it again to the other side. Okay, now.
I hear it synchronously.
Okay, good. Now for your Rhine test.
Stop.
11 seconds. Now to the other side.
It stopped.
Okay, good. 11 seconds also. All in all, it's normal. Now, sir, I need you to open your mouth. I will just depress your tongue. Okay. Okay. The soft palate rises and the uvula is in the midline. Now, sir, I have an applicator. I will just touch lightly the posterior pharynx of your mouth. Open your mouth, sir. Okay. Now, drink small amount of water. Good. Easy for swallowing, negative for hoarseness of voice. Upon checking, normal for the glossopharyngeal and vagus tests. The abnormalities you can find in the facial nerve test is the facial muscle weaknesses. It indicates facial nerve damage. It includes drooping of the eyelids and changes in the nasolabia folds. Aside from that, inability to do upper and lower tasks might indicate motor neurodiseases. And if the patient cannot distinguish taste, there might be a problem in the sense of taste. Take note that tinnitus is an abnormal hearing sound, wherein it's ringing, buzzing sound. Then, deafness and vertigo is also an abnormality in the vestibulocochlear nerve. While the unilateral palate and uvula movement might indicate an abnormality, then absence of gag reflex, difficulty of swallowing, hoarseness of voice might indicate lesions in the vocal cords, paralysis, or other abnormal conditions in the glossopharyngeal and vagus nerve. Now let's move forward in the test of accessory nerve and hypoglossal nerve. Sir, can you please shrug your shoulder, just like this? Okay, I will put pressure on it. Okay, it's symmetrical. Now, please look up to your right shoulder, then left shoulder. Okay, good. Then, put your tongue out. Retract them. Good. Protrude them again, your tongue. Then move it to your right and left. Just like this. Okay. Now, I want you to put your tongue against your cheek one at a time. Just like this. Okay. Now to the other side. Okay, good. There's no abnormalities upon the test of the accessory nerve and the hypoglossal nerve. If the patient is having a hard time doing the task in accessory nerve, they might have muscle weaknesses, muscle atrophy, or fasciculation. And to the hypoglossal nerve abnormality is the tongue atrophy and paralysis of the tongue. Now proceed to the next assessment. Assist the client's gait and balance, perform Romberg test, perform the finger-nose test, then assist the client's ability to rapid alternating action, then perform the heel-to-shin test. Okay, sir, I want you to walk here, from there, then go back to the starting point, and I want you to walk heel to toe, from there, looking straight ahead. Now, heel to toe. Okay, sir, for the Romberg test, I need you to keep your feet close together. Then your arms at the side. Then close your eyes. Okay, now open your eyes. Okay, absent for visible swaying. Now, sir, can you please sit? Sir, for the finger-nose test, I want you to touch my finger, then touch your nose. Okay? Okay, start. You can point your fingers to the tip of your nose. The movement is smooth. Now, I want you to do a pronation and supination to your hand, just like this. In a rapid speed. Okay? Okay. Okay. The rhythm and the movement is smooth and symmetrical. Now, sir, I need you to do a supine position for the heel to shin test. Okay, good. The movement is smooth and there's no abnormalities upon doing the test. If the patient have difficulties in walking, he might have alcohol intoxicated or using drugs. Other than that, the patient might be suffering from motor neuron diseases or muscle weaknesses. Then, visible swaying indicates of decreased posterior column in the spinal cord. Now, let's do the next procedure. Assist the client's ability to identify light touch, distinguishes the difference from dull and sharp, distinguishes temperature and the ability to feel vibrations. Sir, I want you to close your eyes, then say yes if you feel a stimuli, then tell me what kind of touch you are feeling, then its location. Okay?
Yes. 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 All of them are lightly touch. I felt it to my arms,
Okay.
neck, forearm, then my hands.
Now this time, sir, tell me if you felt dull or sharp. I will touch you with this paper clip. Now close your eyes.
Now it's sharp. Now it's dull. Now it's dull again.
Okay, now open your eyes. Tell me where its location.
To my both arm and neck.
Okay. Good. You are also correct, sir. Now, sir, this time, tell me the temperature of the object you will hold. Now, close your eyes again. Hold this.
It's hot.
Okay. This.
It's warm.
Now open your eyes, sir. Yes, you are correct. This is hot and it's warm. Then, sir, I will use tuning fork for you to feel a vibration. Say yes if you feel vibrations in your body, but tell me stop if you don't feel any vibrations. Now close your eyes again, sir.
Yes.
Do you feel any vibrations?
Yes. Yes.
Okay, good. There's no abnormalities upon the test. Take note, anesthesia is an abnormality. It is a loss of sensation. And the hyposthesia is a partial loss of sensation. Then analgesia, it is an absence of sensibility to pain, while hypalgesia, it is a diminished sensitivity to pain. If the patient cannot feel any vibrations in his body, he might be suffering from neuropathy problems. Continue to the assessment. Test the stereognosis, graphesthesia, the client's ability to discriminate between 2 points, topognosis, and the position sense of joint movement. Sir, now I need you to identify the object I will give you. Close your eyes, sir. Okay. Now, to your right hand, please identify this object.
It's a coin.
Okay. Now to your left hand.
A hairpan.
Okay, good. Open your eyes, sir. You are correct. This is a coin and a hairpin. Next, sir, is I'm going to write to your palm of your hand a letter and tell me what is it. Now close your eyes again, sir. Give me your right hand. What letter is this?
M.
Okay. Now to your left hand.
It's Q.
Good. You are correct. The letter in your right hand is letter M, while in your left hand is letter Q. Now, sir, to discriminate between 2 points, I will touch you with this applicator. Then, say now if you felt it. Close your eyes, sir.
Now. 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 Now.
Open your eyes, sir. Tell me their location.
It is both in the middle of my forearms, the right and left, then both to my knees.
Okay, good. Okay, sir, I will move your thumb of your foot into a dorsiflexion, plantar flexion, or abduction. Tell me what move I did. Okay?
Plantar flexion. Dorsiflexion.
Next.
Abduction.
Okay, good. You are correct, sir. It is plantar flexion, dorsiflexion, then abduction. Remind you that if the patient cannot identify the object in their hands while their eyes are closed, they might be having a cortical disease. While inability to feel separate 2 points or sense the joint movement, the patient might be having a sensory problem. Now, let's do the procedure to the assessment of reflexes. Assess the client's bicep reflex, tricep reflex, brachioradialis reflex, patellar reflex, Achilles tendon reflex, plantar reflex, then the abdominal reflex. Sir, we will proceed to the assessment of your reflex. Now I need your hand. Okay. Okay. Next, to the other side. Now to your patellar reflex. Okay, now sir, can you please do a supine position for your abdominal reflex? Okay, sir. Although you have a positive 2 reflex, which indicates normal, there's no abnormalities upon the test. Bear in mind that no response or diminished response might indicate lower motor neuron disease, while brisk above normal and hyperactive response might indicate upper motor neuron disease. And Babinski disease is an abnormal reflex to more than 2 years old and above.
Document all the findings. Evaluate the other need of the client. Wash your hands properly, then discard the used gloves.
I hope I clearly demonstrated the neurological assessment. Once again, Kaalaga, your future nurse, Love, Leia. See you and thanks for watching. Bye!